Welcome to the RCM Ladder. We dive into career development and growth for revenue cycle professionals, helping you level up your career one episode at a time. This episode of the RCM Ladder is brought to you by our good friends at the Health Exchange. They are building an awesome community of revenue cycle professionals with the knowledge, insights, and resources needed to navigate the ever-changing landscape of healthcare reimbursement. The team at the Health Exchange have awesome content and events tackling everything from denials management to revenue integrity, patient access, and the importance of leveraging RPA or AI in your operations. The content is so useful, so smart, so impressive, so collaborative. Honestly, it makes us jealous. So go check them out now, right now, and then come back to us. You can find them at healthexchange.io. That's HEALTHXCHANGE.io. And now on to this week's discussion. Hello, welcome to this week's episode of the RCM Ladder. I am your host, as always, James Furbush. My guest this week is the one, the only, Becky Peters. She is the Executive Director of Patient Access for Banner Health. Becky, thank you so much for joining the show today.
Oh, thank you.
Yeah, so Becky, I'm really excited to have this conversation with you because, first and foremost, your background, at least looking on LinkedIn, you have done everything. It is an impressive resume for sure. And I would love to if you could start, just tell the audience a little bit about what your responsibilities entail at Banner. Obviously, it's a very large health system. I would assume most people have heard of Banner, but you never know. So if you could just give people an overview, what are your main responsibilities, and maybe even just a little bit about who Banner is for people who don't know.
Yeah, absolutely. Banner Health is a large integrated healthcare system. We are currently in 6 states. Most of our organization sits in Phoenix, Arizona, but we do have hospitals in California, Nevada, Wyoming, Colorado, Nebraska. I've been with Banner now 6 years and have a large team. I have an umbrella of about 1,200 employees that report under Patient Access. And I have responsibility for registration across all 33 of our hospitals across the 6 states, as well as our revenue cycle education and quality assurance team. We also have a corporate financial clearance team. So that team is responsible for authorization, validations, prior auth submission, financial clearance, pre-reg, estimates, collections, financial assistance for both our acute and ambulatory. We have a Banner Medical Group and a Banner University Group of over probably 450 locations for our physicians. I also have oversight of our ambulatory Banner imaging department. So again, we are doing pre-registration authorizations for all of our imaging locations across 2 states, as well as working with continuous improvement, vendor management, business analysts, and educators.
You are busy most weeks.
Yes, I have a great team that supports me, and we've been able to do a great job and be very successful.
How do you use 1,200 people sort of roll up to you ultimately? I'm very curious how you manage, how do you get that many people aligned and rowing in the same direction? That is that's a massive amount of people.
And it doesn't count the staff that at the front desk at all of our clinics. They have a dotted line to us. I will say though, getting everybody rowing in one direction is a journey. I don't know that we're ever 100% there, but the way we've done it here at Banner is really created a mission statement and a vision of what we wanted to accomplish, and being very strategic in how we laid out the journey, how we were going to get there, and what we needed people to understand, We created an organizational structure that really allows us to be able to communicate to the front desk staff as clearly as we're communicating to each other. So I have a corporate team of 7 direct reports to me, and they manage different kind of regions. So I have 2 senior directors over my acute care teams. They kind of split all of our acute care hospital. They work with the directors or regional directors in each of those sites. And we have a standard vision and mission statement, as I stated before, that we really have spent a ton of time marketing to them. We're sort of mini salesmen when we're going down and having meetings with our leaders and with our staff. I also have a leader over our education team, a leader over our remote pre-registration financial clearance centers, a leader over Banner Imaging and the ambulatory side. So we've created a lot of flexibility that allows us to pivot very quickly, having the analytics and the data that helps us understand where is everybody at. Are they on the right path? Did they veer off, and how do we get them back? So we've spent a lot of time kind of creating excitement around who is patient access and what do we do and what do we offer to our organization. And with every small step that we've taken and we've been able to show them what they've accomplished, and having numbers and transparency in front of them along the journey has definitely helped. We have a very open leadership team. It doesn't really matter what your title is. We make sure that we're meeting all levels. I personally go to every single hospital once a year, meet with the leadership team, do roundtables with staff, making sure that we are hearing their voices and that what we're doing strategically is meeting their needs as an employee and meeting the needs of the patients that are coming in their front doors.
Oh, wow. Yeah, that's incredible. You know, for you, what are some of those kind of key skills then that like you've sort of leaned on in order to, right? It's like I've heard in that sort of answer, it's like the ability to communicate, salesmanship, setting a mission and vision, but I'm curious, what are, as you sort of think about what you're able to do as a leader at Banner, what are some of those skills that you've sort of leaned on and developed over the course of your career that has sort of helped you be able to lead that many number of people across that many different care sites and states?
Yeah, I've been in healthcare for probably 35 years. The skills that I have now have definitely been developed over many, many years and many opportunities. But one of the things that I feel has helped me the most is learning how to be an active learner, not just a listener, but an active learner. Every position I've ever had, I really try to take the best that position offered me. So whether it was a best practice, a technology, vendor relationship, leadership development, and then taking everything that I've learned to the next place and assessing each of those organizations or teams with a very open mind and not using a cookie cutter solution, not coming in thinking I already know how to fix it before I even understand what the problems are. One of a leader that I've had that I really enjoyed working for told me my first mission as a leader is to do no harm. So when I come into a place, it's not to come in and just start making changes, but it's to sit down beside the people that are doing the work, understanding what their challenges are, what systems they're using, doing a lot of conversations and relationship building to understand how do we get them where they need to be, but do I first even understand where that is? So building that authentic, supportive, and engaging relationships with those that I work with and being open, I think are two of the key skills that have helped me along in my career and helping my teams be successful.
I love that spin on sort of the Hippocratic Oath. But
Yeah.
right, like, but taking that and applying it in a business sense. And I mean, really, in some ways, not just, you guys are taking care of patients as well, but also having that apply to the people that report to you. That's very powerful. It's like a very powerful way to kind of spin that. Are there things that you look back on? You said that you've been working in healthcare for a little bit now. Are there things that you encourage people at the beginning of their career? So if there's someone who's just out of college, for instance, and they are in revenue cycle in some capacity, what sort of things would you encourage them to work on to be able to start adding that rocket fuel to their own career?
Yeah, I would say take every opportunity that's given to you. And don't be afraid if it's something that you're not exactly sure that you're qualified for. Be curious when you come into a role, right? There's no role too small to start at. A lot of folks feel like, I get out of college, I want to be a manager. But I'm of the school of thought that you need to be an expert in the work that you do, and you need to understand the work that your team is doing. So we very much encourage people to become subject matter experts in their line of business. And you do that by being super curious, being willing to take on stretch assignment, asking if you can do more, learning how to network, learning from others and not getting stuck in the way you think it should be done, or even your organization who feels like they're a best practice organization. We can always learn to do better. I would say as you're walking through your journey and growing as a leader, to leverage that knowledge and experience in all your connect, not just those in your inner circle, but be courageous in meeting people from other healthcare organizations or vendors or payers and staying connected with those people. Healthcare is a very small circle. Every time I go to a conference, I meet somebody that I met 20 years ago, or I've worked with them at multiple organizations. I have friendships that have lasted well over 20 years. And those are powerful when you need something where you're trying to figure out a problem like COVID or a new government regulation. More than likely, somebody is already doing something that is working. So instead of trying to create the wheel every single time, I really utilize my network to say, what are you guys doing? What vendors are you using? And the space is proactive. So if you're somebody who's new that's coming into healthcare, the first thing to understand is this can be a very rewarding and lifetime career if you're willing to take some rests.
Yeah, I have found that in my career, in some ways, your network is everything. Having the ability to stay in touch with people or even to give, right? It's like when people reach out and they're like, hey, I got a question. It's like, I will always make time, even if there's no benefit for me other than just the kindness of trying to pay it forward to someone else in the hopes that when you need a favor, they will pay it back.
Oh.
Like dealing with the complexities of revenue cycle, whether it's, oh my God, there's a pandemic and we can't be in the doctor's office, or even now with the state regulations where I honestly have no idea how anyone stays on top of all of the things that happen at the state and the federal level that sort of impact your job. It's much respect for anyone who can stay on top of that, because I certainly can't.
It's a crazy world.
Yeah. So you mentioned sort of the concept of like, no job, like no opportunity is too small, like leaning into the opportunities you're given, which is sometimes not, it's hard to do early in your career when you do feel entitled. As you sort of mentioned, like sometimes people are like, I have to be a manager. Why am I not at this level? But I want to sort of go back to that and unpack that a little bit. But so for you personally, like how do you approach, or how have you approached the mindset to sort of take advantage of the opportunities that you are given or that you have? Like, can you go into that a little bit more? Like, what do you mean by sort of like taking advantage of those opportunities? Is it like learning as much as you can? Like what? Say more
Yeah,
about that.
I think it's kind of multi-pronged. I think any role that you have, whether you're a registration person at the front desk, whether you're, working from home, whether you're the associate manager or the executive director, there is an opportunity every day for you to learn something new. And so when I first started my career, I didn't know that I wanted to have a healthcare career. I just, I needed a job that paid very well. I enjoyed the medical field, kind of that feeling that you were involved in something bigger than yourself. But I really didn't have any idea where it could go. But what I did enjoy was I got bored very easily. So it was like, okay, I got this. Now give me something else. And even if you don't pay me more for it, that's okay. Let me learn something new. And that really was kind of my mantra for many years in my growth. And so I was always willing to do something, even if I wasn't exactly sure to do it. Like if you're willing to teach me, if you're willing to show me, I'm willing to do it. And because of those things, other opportunities kept opening the door for me.
Yeah.
One of the things that we do here at Banner that we're very proud of is we do a ton of internal promotion. But to get people ready for that, we do offer kind of opportunities for them to have a stretch assignment. So are you willing to be an interim, in another facility, even in another state, to give you that opportunity to kind of get out of your comfort zone, work in a hospital maybe that you're not familiar with, and let's see how you handle, kind of that challenge or that stress. And we've been able to do that with several leaders over the years, and every single one of them have been promoted. They may have started off as an associate manager, they became senior managers, or senior managers who are now directors. So I think that you can never be afraid of trying something. I've taken many jobs that were lateral moves, not upward moves, because I was missing a piece of the puzzle. So I've had HR, HIM, I've had coding, I've had the PBX, I've been in the back end, the front end, but many of those moves were lateral. It wasn't, every move wasn't to get a promotion. Sometimes it was just to gather more knowledge. So when the opportunity that I really wanted came along, I would be prepared for that. So I think giving our leaders chances to take those stretch assignments, even if it scares them or they think they might not be ready, really prepares them. I think taking advantage of educational opportunities as well. Again, this is something that I'm really super proud of at Banner. Banner is definitely willing to invest in their employees and provide educational opportunities. And with our revenue cycle education team, we've purchased all kinds of free training and certification programs. We have a enterprise membership to HMA. We probably have over 50% of our staff now that is CRCR certified. We pay for your NAHAM certification. We treat roadmaps for career building. So we have all of this out here available. And now the staff, though, they have to take the investment. I'm not going to spoon feed it, right? It's here. We have created all these opportunities. Now it's up to you to decide, how hungry are you? How much do you want?
I mean, it's probably good to, as an organization where you probably do get a good sense of who those, I don't want to call them necessarily A players, but the people who are hungry to learn and advance. Typically, those people I find are the ones who do take the initiative to sort of, they're like, yes, absolutely. I'm going to get the certification. I'm going to learn this thing. I'm going to do everything I can to better myself professionally, I guess.
It's very easy to spot. I think, as our leaders are having one-on-ones and having development conversations and talking about, succession planning, there are folks who talk about it, and then there are those that are excited about it. And the ones that are excited and are kind of taking the initiative to do the things that they believe will help them get to the next step are the ones that we will continue to really pay attention to, invest in. We want everyone to find their place, right? Not everybody wants to be a leader. So we want to make sure, if you just want to learn more and become a better expert in your job, we want to provide you that. If you want to grow and learn and be a leader, we want to help you with that. If you want to grow and learn and lead patient access, but move into another area of revenue cycle or within healthcare, we want to help you do that too. So it's really having people get excited, taking advantage of the opportunities they have. And then, the engagement level that we get from our staff and from our leaders who see that and are hungry for that is incredible.
Can I ask a really dumb question?
Yes.
What is
There are
this?
no dumb questions.
Oh no, this is probably a dumb question. I say dumb because I'm probably just embarrassed that I'm even asking this. This DRCR, so I've seen that a lot. What does that stand for?
For a certified revenue cycle representative.
Okay.
Yeah. And it's something that, Banner took an investment in being an enterprise member for HFMA. And I think it is just an incredible benefit that they provide to us. And when we looked at the CRCR, especially for our patient access team members, we were so excited that we had something that we could offer them that normally would cost, a significant amount of money for them, but gave them a high level overview of everything revenue cycle. Since COVID, the staff that we're hiring, many of them have not ever been in healthcare before. They don't even know what revenue cycle is, right? And so as they come on board with us and we start, training them and educating them and helping them understand what this machine is that they've now come a part of, we love being able to offer that CRCR, right? Because it takes some intensive studying, but it gives them a really good overview of everything from start to finish and where they're at in that revenue cycle and the impact of the work that they do, how it impacts every piece of the revenue cycle going, down to collections and final statements and billing, and really how they're impacting the financial performance of Banner. So it's been incredible to me how many staff members that we have had take it. I think last year we had well over 200 people just in patient access who got their CRCRs.
That's amazing. Well, and it's so hard too I think one of the biggest challenges a lot of organizations have is like getting employees. We'll just say just employees, frontline employees, people who are maybe like many levels removed from, say, the C-suite, senior leadership level, is like getting them to understand the impact that they can have at the larger level. And like if you're taking a patient's insurance, sometimes it's hard, you don't realize the impact that actually you do have on the Banner, bottom line, the full picture. So it's kind of great that like a lot of the people on your team are getting that, because I would imagine like there's a higher level of engagement as well when you can see your role connected to the larger mission of your team.
Yeah, and that's really the goal. Like, is the certifications improving our performance? Is it improving our engagement? Are people feeling comfortable that Banner is a great place to work? Are we showing them that the work that they do is valuable? So I think the answer to all those questions is yes. I think some people, everybody's going to have their different level, but especially in our leaders, it has really helped them, I think, connect the dots. We've spent, the last 6 years really helping people understand their key performance indicators and teaching, our leaders how to do KPI and metric report outs, to the CFO level. So getting them comfortable with their data, helping them understand how to root cause. Well, if they don't understand the entire revenue cycle or how they're impacting, those are just numbers. Metrics don't mean a lot unless you can tie it to something that's bigger than them.
Yeah. Oh, that's amazing. I want to jump back. So you mentioned previously that there were some times where you took opportunities and you took lateral moves. And I'm very curious how you, how you or what advice you would give to someone how to approach evaluating like their next opportunity or new opportunity. Because I would think it's hard, right? I think there's a certain mindset where it's like you always got to be progressing forward. If I take a lateral move, that's the equivalent of a step back. But you sort of said that those lateral moves allowed you to then progress forward, which is very interesting. It's a very interesting approach to a career and sort of the evaluation of potential opportunities in your career. Can we just unpack that a little? I mean, how do you sort of think about the way in which you evaluate like what is that next right move or for you personally, or we could even make it unpersonal and just say, like you're talking to a group of college grads who are very curious about the notion of making lateral moves to go forwards eventually.
Yeah, I think it's different, for every person. I think the first thing is to, really spend some time in self-evaluation. Like, what is my goal? Is my goal, to be the leader of this one department and, I want to be the leader at this hospital until I retire? Or do I want to be the CFO someday? So I think, each person has to really sit down and do some self-reflection and figure out, like, where's your end goal? Where would you like to be in the 5-10 year mark? And are you willing to put the time in to make sure that you're successful? Seen a lot of folks who jump too fast. They haven't developed as a leader enough. And they struggle when they get that position that they really feel like they've always wanted. So I think it is, something each person has to do. For me, it was, I wanted to understand what drove me, what was my passion. And I've learned over the years that really it's teaching other leaders, it's developing other leaders. It's giving the people that work with me the tools for them to be successful. But in order to do that, I had to understand the work. So I knew I wanted to be in a role where I could support people, inspire them, create innovation. But I had to have the basics first. I had to understand, my business. And I got bored very easily. So for me, it was like, okay, I've got this part. Now I need to learn the other piece and be challenged. So for me, it was taking those roles, understanding what was I going to learn. I was a revenue cycle consultant for about 6 years. And that was the scariest jump I ever made in my career. Because I was like, I am the revenue cycle expert that these folks are thinking I am. But I had a wonderful mentor. I had people who were encouraging me to take the jump. And that was the best paid education I could have ever received. I was thrown into new situations on every project. I realized where my strengths were. I could assess situations very easily. I made connections and relationships very easily. I, project manage. I could strategically think about where we needed to go. And so each one of those jobs helped me understand where my strengths were, what I was weak in, and what next job I needed to take in order to learn and grow that weakness. But it also helped me identify where my passion was. And that was to be in the role that I'm in today, which is really where I've wanted to be most of my career, and be able to make a significant impact on other leaders and help my team realize their full potential and become the leaders they want to be. So I think as people who are coming into their career, it's really a ton of self-reflection and figuring out with each job that you're doing, what is it about that job you love? And what are the things that maybe you don't like so much or you're not so good at? And how do you get that? And are you willing to take the time to do it versus just being on an upward trajectory?
I love that. And this is going to throw a wrench in my follow-up question. because you kind of said you're like very content and happy where you're at, like everything is sort of coalesced around where you're at now. But do you think, have you given thought to like what you think would come next for you in your career?
Yeah, I always want my span of control to grow.
Yeah.
Um, and because I want to continue to be able to have a positive impact on my organization, on our patients, on our teams. So yeah, I have a lot of ideas and thoughts about how my role can continue to grow um, and stay focused on the things um, that fill my cup and just expanding that. Um, I think you never stop thinking like if you do, then you're probably ready to retire. If you're happy where you're at and content, when
Yeah.
content is sort of the enemy of growth. So, you can never get too comfortable. And I think I'm always looking around to see, is there something else within my sphere of influence that I can grab and learn. I had the opportunity just in the last couple of months to have an interim leadership over a department and revenue cycle that I had never had before, and it was analytics. Not my strong point. So it was a wonderful opportunity to get to know that leader, get to know that team, understand, how I could better leverage that group, what work they were doing, the impact. So that created a new fire in me that I hadn't had that team before. So I'm always willing and very open to looking at departments that are not traditional in patient access.
The ability to go to a new department like analytics that's not your strong suit. It's kind of exciting. I mean, it's like scary, but it's exciting because like you can kind of go in with like fresh eyes, like to be able to ask dumb question and there is a certain level of when things are always done the way they've always been done, but maybe they shouldn't be done that way. And it does take sort of the like someone like yourself coming in um to
Well,
sort
things
of
are changing so fast, but the
yeah.
technology is changing faster than we can keep up. So what I knew about billing and uh, those types of things have changed dramatically since I've been focused, on the front end. So
Yeah.
I haven't been a back end revenue cycle person for several years now. It's not, I don't believe that it's something that I couldn't do, but there would be a lot to learn to go back, because that's not been my focus. So
Yeah.
I think any area, whether it's in the revenue cycle or even finance or patient experience or the digital front door, those all have lines into the revenue cycle. Um, and all of those areas are making changes so fast, that you can't ever keep up with all of it. So I think that's why we always have to have that ability to be open and willing to learn and willing to take a risk and maybe step into a department that has not been traditionally, something we were concerned about or interested in. One of the things that is taking top level in almost every conference I've been in the last year or two is AI. AI scares me to my generation, I am older and get, not too far from retirement. And it's something that I'm not super comfortable with, but it's the future of healthcare in many ways. And so if I were to say, I'm not interested in that, I don't understand it, I'm going to get left behind really, really fast. So being open to that and saying, okay, who do we partner with? How do we learn more? Can we bring in leaders that understand it better, that can help us identify areas, where we might be able to use that? So I think we always have to make ourselves uncomfortable.
Yeah. The making yourself uncomfortable or being willing to be uncomfortable is so important for growth overall. Because it's funny because it's like AI. I feel like that is one of those things too where there's been a few moments in my career where I'm like, ooh, if I don't learn this like internet thing, like I'm gonna get left behind very quickly. And I feel like AI is kind of almost very uh on that same level. And yet it scares me to no end.
Today it does X, Y, and Z. Tomorrow it rules the world. So it changes as soon as I think I'm like, oh, I understand the difference now between machine learning and some of the AI, and then tomorrow it's a completely different world. So it is an interesting time.
Yes, someone always said like you never know actually like where on the hockey slope of innovation, like are you like way up on the curve or are we just kind of like down here? But it is changing so quickly. So, it sounds like the ability to learn, the ability to be uncomfortable, I'm curious that that's a really great foundation for being able to sort of adapt and change and morph with a bunch of different when things change. But I'm curious for you, like over the course of your career, like what has been like the hardest thing about working in revenue cycle? Like, is there one thing in particular? I'm just very curious for you as you sort of look at the totality of your career. It sounds like you've got a great skill set for maybe nothing is hard, but I'm just very curious.
No, there are lots of hard things. I would say one of the hardest things um, that I've had to work through and will probably always have to work through, especially in the front end of the revenue cycle, is getting people to understand the value of the work that the registration teams do. And it has changed significantly over the years. 20, 25 years ago, registration was pretty basic. We didn't have a ton of insurance plans to choose from. The authorization requirements were pretty simple. There just wasn't as much skill around having to do it. Today, we have moved a lot of what used to happen in the back end to the front end. So it really does start and end with that group and the level of complexity that they have to do with all the, insurance and government regulations and HIPAA and compliance, No Surprises Act and everything that has to happen. So a big part of the challenge that I've had over the years is helping our C-suites understand the value of their front end teams and helping them understand that this is a professional position and a professional career, and that we want to hire people who have the ability to really manage multiple complex jobs all at the same time and really understand how to prioritize and be technical and be very comfortable talking about finances. And, oh, by the way, you need to smile and be the face of the organization the first time the patient walks in. But you need to do it in 3 minutes or less. So really helping our organizations understand the impact of patient access and making sure that we have the tools that we need to automate things that, we don't need to spend time on. And I feel like we are finally at a place where that's happening. We're still one of the lowest paid positions in healthcare. It's still considered an entry level position. But we're asking them to be responsible for $14 billion worth of revenue coming in the door. So I think it's always a balance. We're always being asked to do more with less. Our teams engaged and focused and developing while making sure that our leadership teams understand the quality of work that they're doing. And I feel like in the last probably 5 to 10 years, we're making a lot of headway there. And definitely the Banner organization has done a tremendous job of that. So I would say that's probably one of the biggest challenges.
It's a big
And
one.
then Yeah, it's very big. And then making sure that we have a seat at the table with
Yeah.
some of the other departments, like for IT, our digital front doors. There's a lot of great work that's being done. Um, and I feel like revenue cycle is not always at the table as early as it could be, or seen as a valued partner in some of those things. Again, I think we're making tremendous strides in that, but it is an area, at least especially for the front end, that it's an area that still needs some work.
Yeah, I've heard that from others, like that sort of having that seat at the table is a really hard challenge. Especially in like we're focused on the clinical side and in, that, which is not to take anything away from that side by any stretch of the imagination. But when you put it like, oh, this role is responsible for $14 billion in revenue, it sort of paints a very different picture about the importance of revenue cycle and what, you all are doing for the organization. Becky, I want to be cognizant of our time together. So how about we make a quick segue to the lightning round? Are you ready? This is a couple quick questions. First answer is the best answer. No wrong answers. All right, here we go. Lightning round question 1. What's the most important metric that you're measuring that gives you the most anxiety?
Denial.
Yeah. I've heard that before.
It's getting a lot of attention.
Yeah. All right. Question 2. What's the biggest goal you want your team to achieve in this year, 2024?
Our biggest goal is to reduce cost to collect. So optimize everywhere we can, whether it's people, process, or technology.
Well, I love that. 3. What's something you wish people would talk more about when it comes to revenue cycle?
This one might get me in the hot seat, but lack of payer accountability and standardization. Not-for-profit organizations are trying to implement a lot of administrative burdens from companies that have a lot more margin than us. The rework that is required by providers to get paid is immense, especially when you're talking denials, incorrect payment. It's just an incredible amount of work.
Yeah, I would second that. I'm sure probably other people listening would third and fourth and fifth and 1,000 that one. Finally, question 4, last one. What's your professional superpower?
Oh gosh. That's a really good question. And that one kind of took me off guard. My professional
was not on-
superpower, I think it's relationship building. I feel like that is something that fills me up and really helps me. And it's something that comes very naturally to me.
I love that. And that's a great answer. And in fairness to you, I did not put it on the questions I sent you ahead of time, but I have been asking it because it's great to hear kind of how people think about the thing that they can lean on, like in their careers as a professional. So I do apologize, but I did want to ask you, and that was a great answer. All right, Becky, last before we let you go, and this has been great. I feel like I could talk to you for another 2 hours about this stuff. So talking Banner Health, are you guys hiring? Sounds like you might be. Where can people go to learn more about working for Banner Health, joining your team? Where would you advise people if they want to sort of join the revenue cycle? Are you hiring? Are there any big roles you're looking to fill? Talk to us about kind of that situation for Banner.
Yeah, I mean, if folks are interested in coming to work for Banner, bannerhealth.com is definitely the place to start. We have a job link within there that shares all the positions that are available. I would say right now, team, I don't have any significant leadership positions available in revenue cycle today or in patient access specifically, but we are always looking for amazing people. the nature of the business, we always have positions available, whether it's in our remote teams or in our physician offices or in our hospitals. And it's a great place to get your foot in the door, to see where else your career can take you within the revenue cycle.
Awesome. Well, Becky, thanks so much for joining the show. This has been an immense pleasure for me. So thank you. If people are listening, they want to learn more, if they want to connect with you, where can they find you? Like LinkedIn, TikTok,
Yep.
somewhere?
I am definitely on LinkedIn, and I am also part of the NAHAM board. And so if you're a NAHAM member, you can reach me through there.
Awesome. All right. Well, hey, Becky, thanks so much. And we'll put a link to your profile in the comments and the stuff so people can kind of track you more easily. Thank you so much for really.
Thank you.